Hello, my name is Will Davis. I'm an undergraduate student at the University of Kansas. My mentor is Dr. Michael Amlung, and I'm a research assistant in his lab through the Coffin-Logan Center for Addiction Research and Treatment. Dr. Amlung and I are curious about the psychological correlates of driving after cannabis use among United States and Canadian adults. And we're interested in this subject because rates of driving after cannabis use have increased in both the United States and in Canada. In the United States, the percentage of motor vehicle accident fatalities involving cannabis increased from 9.1% in the year 2000 to 21.5% in 2018. In Canada, data from the 2019 National Cannabis Survey revealed that 15% of individuals with a driver's license who use cannabis admitted to driving within 2 hours after cannabis use at least once in the past 12 months. And these 2 hours after cannabis use are critical because this is when the effects of the substance are most pronounced. Cannabis use can impair driving ability in different ways. In some drivers, we see reductions in short-term memory, increased reaction time, reduced motor coordination, poor divided attention, and reductions in a driver's ability to stay lateral within their lane. So some drivers weave in and out of their lane after cannabis use. These, among other reasons, are why cannabis use increases risk of motor vehicle accident. Now, people who drive after cannabis use have differing perceptions on the dangerousness of this behavior. Some perceive little increased risk of danger after driving after cannabis use. Some perceive no increased risk of danger, and a small population of people, small percentage of people report that cannabis actually improves their ability to drive. These are reasons why we're interested if an individual's perceived dangerousness, normative beliefs, and perceived negative consequences correlate with the frequency of driving after cannabis use. We're also interested if drivers in the United States and Canada differ in their perceptions and driving after cannabis use frequency. We recruited adult participants from Canada and the United States online. Our Canadian sample had 159 participants, 50.3% of which were female, 85% were Caucasian, a mean age of 32.8 years, and our mean years of education was 16.5. In the United States, our sample was 746 participants, 51.5% of which were female, 73% were Caucasian. Again, we had a mean age of 32.8 years, with mean years of education in this group being 15 years. We assessed participant perceptions of risk and their driving behavior through self-report online survey. If you were a participant in our study, you would have seen a question like this one below. This is an actual question from our survey. We asked the question, how dangerous do you think it is to drive within 2 hours after smoking marijuana? And then participants would select the relevant answer below. From this specific question, we found interesting results. On our graph, the left side is United States participants, right side Canadian. The y-axis is perceived danger. As the bars on the graph increased, so does participant perceived danger. Again, from the question, how dangerous do you think it is to drive within 2 hours after smoking marijuana? We found that Canadian participants perceived this behavior as more dangerous than United States participants. We assessed negative consequences through the question, how likely is it that you will be stopped by police, drug tested, arrested, or have an accident? The gray bar is United States participants, red Canadian. Our y-axis indicates likelihood, which increases along the y-axis. We found generally similar results for these questions when comparing the two countries. The most notable difference was in perceptions of the likelihood that they are drug tested. Between the two countries, we found that Canadians perceived they were more likely to be drug tested after driving after cannabis use when compared to our United States sample. We assessed normative beliefs to the question, how many of your closest friends would disapprove of driving after cannabis use? and additionally refused to ride with a driver who has been using cannabis. For both graphs, our left bar is United States participants, our right Canadian. The y-axis is number of friends. As this y-axis increases, so does the number of friends who would either disapprove or refuse to ride. Between the countries, we found the United States participants had a greater number of friends who would disapprove of driving after cannabis use and would also refuse to ride with a driver who has been using cannabis. We assessed frequency of driving after cannabis use with the question, how many times in the past 3 months have you driven within 2 hours after cannabis use or driven while moderately high? Participants would then enter in their own response. When assessing and comparing the two countries, we found that United States participants reported a greater number of times driving after cannabis use within 2 hours of using the substance. And United States participants also reported a greater number of times driving while moderately high. Now, to connect these questions here, we found that lower perception of danger correlated with greater frequency of driving after cannabis use. So when participants perceived driving after cannabis use as more dangerous, they were less likely to engage in the behavior. Compared to Canadian participants, among United States participants, driving after cannabis use was viewed as less dangerous and more socially acceptable. When comparing the two countries, however, they perceived negative consequences in similar ways. I'd like to thank my mentor, Dr. Michael Amlung, our lab, the Behavioral Economics and Addictions Neuroscience Lab at KU, the Coffin Logan Center for Addiction Research and Treatment, and the Peter Boris Center for Addiction Research. And thank you for listening.